with lesion. In simple word, lesion is basically the inflammation of meibomian glands. So it is, as you can see in this picture, these are the meibomian glands. So these are meibomian glands. Okay, so in this case, as you can see, there is inflammation. So why this inflammation occur? So it may occur due to diabetes mellitus, which may cause the gland dysfunction. It may occur due to seborrhea or blepharitis. So as we know, the main secretion of the meibomian gland is lipid in nature. So we can say that it is lipogranulomatous inflammation. So there is a formation of granuloma, due to which we can say it is a chronic granulomatous inflammation of meibomian glands. So if the inflammation occur, as we know that our cells, they will start migrating towards that area, and there is the formation of granuloma in this case. So it may occur due to the dysfunction of the gland, due to the blockage of the duct, or it may occur due to seborrhea, in which there is the excess production of the oil. So what are its symptoms? So one of main symptom is it is painless swelling. Okay, then other are cosmetic dysfunction, because that thing doesn't look good. Okay, then signs. So its signs are like fame, non-tender lump away from the lid, as you can see in this pic. So this is the lid, and this lesion is present little bit away from the lid. So these 2 points are very important. First of all, that it is painless swelling, and the other is that it is away from the lid. In most of the cases, it affects the upper eyelid. The main reason is due to the presence of more meibomian glands in the upper eyelid as compared to the lower one. So there is no acute inflammation. Then what can happen next? So it may resolve, or fibrosis may occur. It may lead to calcification, or if the infection occur. Till now there is no infection. So what can be its complication? It may cause ptosis, or it may cause blurred vision, because it is affecting our eyelid. So it may cause blurred vision due to pressure on the cornea, and may cause ptosis due to lesion weight. So what are its treatment? First one is conservative treatment. In this treatment, we compress our eyelid. Okay, if it is given mainly if there is fresh lesions, warm compression are given, and topical steroid and antibiotic is also given. Okay, the second one is medical treatment. So conservative treatment is given, then the other is medical treatment. In this medical treatment, we basically give steroid injections. So this is the main steroid that we give. So it is triamcinolone acetonide. Triamcinolone acetonide 0.1 to 0.2 ml. This has 80% success rate. Other is we may use antibiotics if the infection occur. The other and the main treatment is, which is most common, is surgical treatment. So we give local anesthesia, then lesion is everted and incised. As you can see in this picture, we evert the lesion, then we give a vertical incision with blade. So this is lesion's clamp, we place it over the lesion, and this is lesion scoop, from which we remove the content that is present in this inflammation. Okay, the main thing is we give the vertical incision. So the main reason is, as you can see, these are meibomian gland ducts. So they are present in vertical manner. So if we give the vertical, like let's suppose this one is infected, if I give the horizontal incision like this one, it can affect all of the other ducts which are not affected. So we give the vertical incision so that other ducts are not incised in this case. The other infection is hardiolum. It is hardiolum externum. It is also known as TI. So this is basically an inflammation of eyelid gland. So in the lesion, the inflammation occur mainly in meibomian gland, but in this case the gland that are affected are gland of Zeiss and gland of Mole. So there is also acute suppurative inflammation. So there is the presence of microorganism like bacteria, which is mainly the Staphylococcus aureus, but in Clasion there is no presence of microorganism or bacteria. So this is different from Clasion. First one is that it affects the gland of Zeiss and gland of Mole instead of gland of Meibomian. The other thing is there is the presence of a causative organism which was absent in the Clasion. The other thing that differentiate it is there is the presence of acute pain and tenderness. In the Clasion there was no pain. So it is localized, painful, hard swelling near the lid margin. As you can see this picture, this is near the lid margin, because as we have discussed early in the anatomy, the gland of Zeiss and gland of Mole are present near the lid margin, due to which the inflammation occur near the lid margin. Okay, now we will go. Now there is also the presence of yellow abscess formation near the eyelash, and there is pain after pus is evacuated. Now what are the treatments? Like first one is self-care. We give warm compressions for 10 minutes. The other is medical treatment, because it occur mainly due to bacteria, so we give topical antibiotics, eye drops or ointments. The other are anti-inflammatory drugs. Then there is procedure like in Clasion, evacuation of pus is done, and it is also done by the removal of eyelashes by incision, and treat the associated blepharitis if it occur mainly due to blepharitis. We will discuss the blepharitis in our next part. So the other thing is hardiolum internum. So it is like the Clasion, but there is the presence of a bacteria. It is the acute suppurative infection of meibomian gland, because in Clasion there was no suppurative infection. It is simply the inflammation in which there is a formation of granuloma in Clasion case, but in this case there is presence of Staphylococcus aureus. Okay, so because it is suppurative infection, there is pain, the eyelid become red and swollen, more severe tenderness. Clasion there was nothing like pain and eyelid become red or something like that. Pus may come out. Okay, what are its complication? You can see in this picture like this one, it is little bit away from the margin and there is redness and swelling. Okay, it can burst throughout the conjunctiva and it may form granulation. It may lead to secondary infection like cellulitis. Now what are its treatment? Like in Clasion, hardiolum internum, insti, and in this case self-care, warm compression. Then the other one was medical. We give antibiotic because it occur due to bacteria. The other is procedure, in which we give the incision as we gave in the case of Clasion, sty, and this one. Now we will briefly discuss the differences, how we can differentiate between these three. So first one is onset. So it is not important, we will discuss the main points. Okay, the first one is type of inflammation. So in case of sty it is suppurative inflammation, in case of Clasion it is granulomatous, and in case of internal hardiolum it is also suppurative. So these two are suppurative as you can see, but in case of Clasion it is granulomatous, because as we have discussed earlier, there isn't any role of bacteria in the case of Clasion except for its complications. Okay, the other thing is symptoms. So there is presence of acute pain in sty. In the case of internal hardiolum there is also presence of severe pain, but in case of Clasion it is painless. The other thing are signs like localized hard presence of pus, but in this case, in case of Clasion, it is hard swelling away from the lid margin, and there is not like pus present in many cases. And in case of internal, yellow point seen on the everting of the lid. Okay, we give antibiotics because there is no bacteria. We give only in vertical incision for drainage, and in stine we also give antibiotics.